Hi everybody, my name is VanderZouwen. I'm a physical therapist here at Full Potential Physical Therapy. One of the main areas we see people for is shoulder related issues, so I just have some screening questions that I'd like to go through. If you find yourself answering yes to any of these screening questions or trying it out and finding that you have some limitations or that you're sore, you might be a good candidate for physical therapy, and we'd love to see you for a formal plan of care. So one of the first questions that I'll ask people, or something that people will bring up, is that they're not able to sleep well at night, especially if they're laying on their shoulder. So if you're finding that when you're laying on your arms, laying on your side, either the top shoulder or the bottom shoulder, if you're having shoulder pain, you might just be a good candidate for physical therapy. And another screening question would be, can you reach up your back without much in the way of pain? When the shoulder gets stiff, a lot of people end up having a tough time reaching back behind their body. We do that quite often throughout the course of a week, whether it's for bathing or for dressing. And if you're having a tough time with that, again, you might be a candidate for some physical therapy. Can you move your arm quick? So it's one thing to move and reach for something slowly. It's another thing if you have to reach quick to grab something. It's a little bit more energy intensive for the shoulder and strain some of the tendons a little bit more. If that's sore, again, you might be a good candidate for physical therapy. We think of things like rotator cuff issues or tendonitis. So something you could screen on yourself if you're wondering about your shoulders. Another is, can you reach across your body? So that position of reaching across the body, it's a tough position for a lot of people if they're dealing with some shoulder pain, or again, some tendon issues at the shoulder, if they're just generally stiff. And we do that all the time. Think of driving and reaching across your body to grab something, or even sleeping in bed, you might be laying in that position. It's a position that we have to be in quite often, and if it's sore, you might have some shoulder issues going on. Another thing that I've noticed in people is if they're just stiff in their shoulders, it can limit their ability to reach up and overhead. It can limit their ability to participate in things that they like to do, like sports. So one thing that you can do for that, just if you want to do a quick check on yourself, most people can lay down flat on their back, reach their arms up and overhead, and at least get close to the floor if they're in a up high and overhead position. If you can't, it doesn't mean it's the end of the world or anything, but it means you might have stiff shoulders, and it might put you at a little bit higher risk of shoulder issue going forward if you can't do that. So those are all just quick screens that you can do on yourself, or questions you can ask yourself to determine, might you be a good candidate for physical therapy? If you're finding that you are having difficulty with some of those things, feel free to give us a call, and we can do a consultation and see if you really are a good candidate for physical therapy, or we could talk about getting in with your physician so that we can get a referral to get things started. Thanks.